In this video, we will look at the next part of the questionnaire in the household investigation form. But before that, let us have a glance at the questions that we have responded to in the previous part. The following questions were present in the first section. What is the date of household visit? State of the household, district of the household, name of the counselor visiting the household, TU of the household, address of the household, area pin code of the household, what is the mode of screening? The next section is titled Household Member Details. This section comprises of the index patient's household members' details to whom the tool is being administered. Here, in the first question, you have to enter the NICSHARE ID. The length of the ID should be between 7 and 8 characters. The next field asks you to enter the household member's unique ID. These IDs can only contain alphabets. Next, you will find fields to enter the first name, middle name and last name. Enter LNU if the member does not have a last name. The next question in this field are: what is household member age? What is household member gender? What is the household contact number? What is the marital status of the household member? What is the relationship of the household member with the index patient? What is the occupation of the household member? Have you ever taken the TB preventive treatment before, or are you currently taking TPT? When did you take the TPT medication? What type of regimen was given to the household member? The next section is titled Household Member TB Screening. The following questions are asked in this section. Have you ever taken TB treatment before? Are you currently on TB treatment or diagnosed as a TB patient in NICSHARE? Do you have a NICSHARE ID? Kindly provide your NICSHARE ID. The next section is titled Household Member Comorbidity and TB Symptoms. The questions here are: what is your HIV test result? Do you currently consume or have any of the following? Do you have any of the following underlying medical conditions? Which of the following symptoms are you suffering from? The next section is titled Household Member TB Test. The questions here are: have you done any TB test? There are two options here. If no is selected, then the counselor can exit the survey. If yes is selected, then a few more questions will be asked related to the test result. If yes is selected, then you will be asked about the type of test. The options here are chest X-ray, CBNAT, AFB, smear microscopy, TrueNAT and others. You then have to respond to the question about X-ray outcome, CBNAT test outcome, AFB smear microscopy test outcome, TrueNAT test outcome and the test outcome. You then have to respond to the following questions: date on which test was conducted, who helped you in getting the test done, kindly mention the X-ray voucher ID or the CBNAT NICSHARE ID or any other ID. The next question is: has the household member listed chest X-ray as one of the tests done? If the response is yes, then another set of questions appear. The first question here is: what is the final interpretation of tests on the status of active TB? If the response is positive, then exit the survey. If the response is negative or inconclusive, then the next question appears. The next question is, what is the status of IGRA testing? If the response is myco-TB bacilli confirmed or IGRA unavailable, then the next question will appear. If the response is myco-TB bacilli not detected, then exit the survey. The next question is, what is the status of X-ray screening? If the response is no TB or X-ray available, then the next section will appear. If the response is TB suggestive, then end the survey. The next section is titled Household Member TPT Initiation. The first question here is, has consent been obtained from the doctor, public or private, for TPT initiation? If the response is yes, then exit the survey. If the response is no, then the next question will appear. Please note that consent from doctor is required for initiation on TPT. In case the counselor exits the survey, the status of the member will be doctor didn't provide consent for TPT initiation. The next question is, do you give consent for your enrollment into the TB preventive treatment? Again, here the patient consent for initiation on TPT is required. If the response is no, then the next question will be reason for not providing the consent. Please note that this should only be clicked after extensive discussion with the district and state team and after multiple attempts to convince the HH contact. If the response is yes, then the next question will be TPT is being prescribed by. If the member selects others for reason for not providing the consent, then the next question field will be to specify the reason. Once the reason is selected, the counselor can exit the survey. The status of the member will be eligible for TPT but did not give consent. For the question, TPT is being prescribed by, the options are government medical staff and private healthcare facility. The next question is, what is the weight of the household member? The next question is the house member being initiated on TPT in this visit? If the response is yes, then the next question will be asked. The status of these members at exit will be patient initiated on TPT. If the response is no, then exit the survey. In case of exit, the status of the household member will be patient pending for TPT initiation. The next question is date of the TPT initiation. The next question is what type of regimen is being administered to the household member? The options here are 3HP, 3HR, 6H and other regime. Please also note that SKU, that is mg of the given medication, will also be added. If the response is 3HP, then the next question will be quantity of the tablet given, 3HP. If the response is 3HR, then the next question will be quantity of the tablet given, 3HR. If the response is 6H, then the next question will be quantity of tablet given, 6H. If the response is others, then the next question will be please specify others. When you have specified the others, the next question will be quantity of tablet given, other regime. Once the quantity for the regimen is specified, the next question will be Is any supplementary medication given to the household member? There are two options here, yes and no. If yes is selected, then the next question will be, kindly select the supplementary regime given to the household member. If no is selected, then the next question is, quantity of supplementary tablets given. For the question, kindly select the supplementary regime given to the household member, there are two options, pyridoxine, other, specify. If pyridoxine is selected, then the next question will be, quantity of supplementary tablets given. If other, specify is selected, then the next question will be, please specify others. The next question in the survey are, number of tablets given to the patient, number of days tablets given for, number of tablets per day. Once all the questions in this section are responded, you can move to the last section, which is titled Exit Survey. It has the following fields: GPS coordinate of the household, counselor or household member comment, household member status. Once all the questions are responded to, then you can click the Submit button and a thank you screen will appear. This completes the video in Household Investigation Questionnaire.